Are you having a baby soon? Here is tip number 3 from your helpful midwife, who is delivering hopefully some advice that you may not have heard from your midwife and antenatal clinic. Don't get too upset with her, it's just the NHS is really busy right now, and quite commonly you only have about 5 minutes per person to tell them all they need to know, which is definitely not enough time. So tip number 3 is definitely knowing your pain relief options. Now there's a really good website called labourpains.org, and you can go on there. It will tell you everything you need to know about epidurals. And stop, I know some of you are thinking I don't want an epidural. That is totally fine, but I would just have a little look up what it entails, because quite commonly people will always say to me that an epidural, the idea of it, is worse in your head than actually what it was in reality. The only thing I will say is, though, there are not that many anaesthetists per labour rooms in your common standard NHS hospitals. So if you're looking for an epidural and that is definitely something that you really want as part of your birth, I would get in there as early as I can with my request. That's all I'm going to say on the matter. Also, it's worth having a little look up TENS machines. Now, some people love them, other people hate them, and they end up thrown away in a corner and don't do anything else. But TENS release, they apparently work on the natural endorphins in the body, basically your natural pain relief mechanisms. So I would say it's worth a go. Some people love them, other people hate them, so why not give it a try? You can actually rent them, so you don't need to invest money directly into them. Now, pethidine and diamorphine are also injections, which you can have when you're an inpatient. The only thing with them is they do pass through to babies, so there is kind of like an optimal time to have them, and I would say it's generally sort of on the earlier side of your labour. If it's your second baby, or if labour's speeding along really quickly, what could happen is the baby's born a little bit too quickly, and they are born and they're still under the effects of the pethidine or diamorphine. It's an opiate, so it makes them really sleepy. So definitely have a little look into all of that. At home, a nice warm bath, not too hot. Warm bath is always quite good. Massage, we get your partners to do a little bit of that. That's really helpful. And a nice relaxing playlist just to get you in the mood.